Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos, and if you're new to us, man, we're super excited to have you here because we're having some incredible conversations with real leaders that are painstakingly shaping the future of healthcare. We're really passionate about a few things. We're passionate about innovation, leadership, access, and innovation adoption. And if it's your first time tuning in, let me just tell you a quick little tidbit about what we're really trying to get done here. So, our focus is about real stories of innovation and bringing them to life, focusing on those that are actually getting stuff done in the trenches and giving them the opportunity to share their stories, their wins, their learnings with our community, and ultimately giving them a platform to share that stuff with the world. We've got an amazing action-packed year, so if you hadn't had an opportunity, make sure that you, wherever you're listening or tuning in from, hit the subscribe button now so that any new interviews go directly into your inbox. So in our field, they're moving quickly, they're evolving fast, and it's crucial to have leaders who can envision a future differently, that are eagerly embracing innovation, and they're addressing pressing challenges. And we have no short of challenges, which means that we've got a lot of opportunity to make things better. And our next guest on the show is actually one of these leaders. I'm just really excited about this. So today, I'm thrilled to have a conversation with Bradley Bostic. He's been founding, leading, and investing in high growth tech companies for the last 25 years. Bradley is the founder, chairman, and CEO of HC1, a company that specializes in transforming lab data into personalized healthcare insights. So, under his leadership, HC1 has developed the Precision Health Cloud, a platform that integrates patient health data from various sources to uncover actionable insights, informing individuals' care decisions. So, HC1 is not just a startup, this is a company, this is an international leader. They're using AI to identify these risk signals, and they've got more than 260 million unique patients. So this innovation has been pivotal in advancing precision health by organizing lab data to deliver these care insights. So Bradley's really deeply rooted in cultivating and operating a lot of these groundbreaking companies. He also serves as the managing director of Health Cloud Capital, a private equity fund that's focusing in on growth stage precision health SaaS companies. He's been recognized as a 40 under 40 leader by the Indianapolis Business Journal, and he's been honored by Becker's Healthcare as a Becker's Healthcare top entrepreneur. So, I mean, these accolades, guys, gals, it only tells part of the story. Like, really, we're only tip of the iceberg here. So, in our conversation today, we're going to explore Bradley's journey and even rethinking how we think about and utilize healthcare data and innovation. So, Bradley, welcome to the show. It's great to see you.
Thanks so much, Michael. I appreciate you having me on. Looking forward to the conversation.
Yeah, yeah. So, I mean, so Bradley, you've built a pretty awesome reputation as a visionary within healthcare transformation. From innovative tech to empowering organizations. Let's just start light. What's one thing about you that most people wouldn't find on a Google search or from your LinkedIn profile?
Well, probably the fact that I grew up in South Dakota and while I was a kid, fell in love with the mountains and the snow. We would go out west to the Rockies very often. So this time of year, I've got both of my snowboards ready to go and all my trips lined up. Actually heading out to Telluride for a week on December 27th, and just can't wait to be out there on the edge of out of control on my snowboard. So that's a not that well known fact.
Okay, right on. Um, I was really excited about our sort of our initial conversation and kind of moving into this one. And you mentioned that, there were some personal experiences, including a family member's battle with cancer. And then you kind of highlighted a lot of the inefficiencies within the healthcare system, and that sort of inspired you to establish HC1. Can you share a little bit more about how these experiences, shaped your vision for HC1 and its mission to transform, lab data into these, personalized healthcare insights?
Sure, that's correct. I did have a really impactful personal experience with healthcare back in the year 2000. My mom got diagnosed with stage 4 cancer, and many people have had very similar experiences. I've come to learn a lot of them who have taken that energy that was so painful and moved it into making an impact on other people's lives through the delivery of healthcare innovation. In my case, I had been working at Ernst & Young doing consulting. And prior to that, I had started an e-commerce company when I was in college at Indiana University. So I had some experience with internet technology and about how the web was transforming the way customers got engaged.
Hmm.
And that was through the lens of a consumer focused e commerce approach. Then I moved into the healthcare industry where I was doing consulting and I saw how siloed the environment was. And
Right.
really was blown away at how, while in e commerce, the entire model was built around the customer. In healthcare, the entire model was built around more of the physicians and the business administrators and really focused on how you could document and code for things so that you could bill for them. It was just really an eye opener for me. And then as I was doing that, my mom gets diagnosed with stage 4 cancer. And she was a person who had really good insurance. And she and my father had a situation where she could afford to try anything that she could get access to. And I just couldn't believe how these really hardworking caregivers were not set up in the best way because things were so siloed for the patient. So, what I was seeing behind the scenes and how broken down these silos were, I was then seeing out there in the real world with a patient that I cared a lot about, who I loved, who was my
Yeah.
best friend, and it just really made me, excuse me, made me think somebody could do this better, might as well be me, and dedicated my career to trying to make that better. And I'll pause there, but I can talk to how that manifested in what we're doing at HC1 today, because it is very much related.
Yeah. 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 You mentioned co-founding another company. I think it was Cha Search. I mean,
Yeah, I've
this,
started a bunch of companies, but yes, along the way, I started a company called Cha Cha that was a really cool idea. It was actually very similar to what ChatGPT is today, where you could ask any question and get an answer back. And in that moment in time, which was like 2004, 2005, when we got started, the resources from an AI perspective were not nearly as robust. In fact, they weren't
Mm,
even in the same universe as what you have today. And so we had this combination of human intelligence and technology that would result in, instead of a list of search results like Google, it would result in an actual answer to your
yeah.
question. And so that was the one thing I did outside of healthcare along the journey. But actually, what I learned through that has helped me deliver better solutions in healthcare as well.
You know what's interesting is like you talk about all those different things that you've done, but for me, that these are all different tours of duty, and you've accumulated all these experiences along the way. I'm curious, what lessons, whether it be from Cha Cha or from earlier ventures, have been most valuable to these other subsequent endeavors that you're on now, and then maybe you can use that to kind of build into what you and the team at HC1 are doing.
Yeah, I'd say a couple of lessons. One is from an economic perspective, always build a model that has true recurring revenue. It just makes it more possible to innovate the way that you want to over time because you're not constantly having to reload the cannon and chase whatever that next dollar is.
Right.
That's just because if there's no margin, there's no mission. But thinking more about from a business perspective and how do you execute effectively, I think first of all, you have to make it so that what you're doing can be communicated in a really straightforward, simple, easy to understand way. And in
Sure.
healthcare, we generally suck at that, right? Because to do anything in
Yeah.
healthcare, it's really complicated.
Yeah,
And we
it
live in
is.
this environment where people speak in acronyms and the way that things get paid for is complicated, the way that the data moves is complicated. So I think it's just so important to be able to explain really succinctly in a way that somebody would actually care to listen further what you're delivering. And then the third thing I would say is to have an operating model where execution can occur in a dynamic environment effectively, because all too often we start sprinting down the path with some type of innovation. And especially in the software space, all things are possible with code. And you can end up really giving your team a lot of whiplash if you're
Mhm.
not careful. So for me, it's really having an operating model where you establish objectives for the company. You have the right cadence of weekly meetings so people know what their objectives are and how they align with the company, that sort of thing. It sounds really basic, but it's those changes to the way that I've operated over time that's made it so in the early days, it was just a lot less efficient to go achieve some type of objective. Now, with the right people aligned in the right operating model, when we have something we can explain clearly to the customers we're targeting that has a compelling value proposition, when we put that inside of this operating model, come to find over time, you end up making a lot of progress, which makes it a lot more fun.
Yes, I mean that kind of dovetails into, look, a lot of companies they start in startup and they end in startup. In your case, you've gone from startup to international leader. And it sounds like you said, aligning on an operating model and building a very compelling narrative that speaks to the pain points of others that are experiencing those pain points very clearly. Were there other key strategies and decisions that facilitated this type of meteoric rise and growth? I mean, and then how do you ensure that you guys continue to innovate, especially in our space it's always changing and it's always evolving?
Yeah, you have to be curious in order to be successful in healthcare because it's changing so fast. If you don't have a general predisposition toward curiosity, it'll chew you up and spit you out. And I've seen people like that have been successful in, say, marketing automation. They come over into healthcare tech, and this isn't a blanket statement for anybody,
Yeah,
but
yeah.
some people I've had experience with, they came into healthcare and they were just completely destroyed by the pace of change and how dynamic it was. I'd say the other thing, though, that's really important is to ensure that you're aligning your innovation with a really clear economic driver because
Mm,
healthcare, it's just there's so many things that are illogical and irrational about how healthcare operates. So if you
yeah.
just look at it from the standpoint of, let's think about common sense, how should this work?
So,
Well,
hey,
it
it's
should
better
work
for
this
the
other way.
patient. It's better for
Yeah,
the
right,
patient.
right,
Nope, we're
exactly.
not
Yeah,
going to do it. We're
yeah,
not going to do
exactly. Yeah. Yeah, yeah,
it.
yeah. I mean, if there's not an obvious economic driver that's compelling to the CFO, it doesn't matter if it's magic in a bottle. They will be, and it's free, they will be unwilling to use it. And so I think being very clear about how you're connecting between your innovation and an economic driver that matters to a large, well-funded constituent in the healthcare continuum, it just doesn't, it won't work unless you have that. The other thing I would say is healthcare is so vast that inside of it, it has all of these separate businesses. It's almost like a collection of it's its own
Yeah,
economy, right? And it's this
sure.
collection of all these different businesses. And each of these businesses have different decision-making processes for purchasing and different motivations for investment. And so for my strategy, I started Health Cloud Capital with a partner, Travis Morgan, my longtime partner, who has a really strong finance and science background, because we saw that there were all of these areas in healthcare where if you could harvest deep data sets and enrich and organize that data into more of a useful health matrix that told the story of a patient journey in a certain
Mm,
area, you could drive huge value. And that a small niche inside of healthcare is $50 billion, right?
right,
It's
right.
staggering. And so we're all about with Health Cloud Capital these deep vertical areas where we can harvest insights from the data that will improve outcomes for patients and boost the bottom line for healthcare. And when you do those two things together, you end up with something that can scale to be a national and international, noteworthy company. We have inside of our portfolio now three primary operating businesses that I started or co-founded. One is HC1, which you mentioned, and I run that day to day. I'm an operator first and really an
Hmm.
investor as a result of wanting to do more than what I could do without having a fund. So HC1's the leader in really transforming lab data into personalized insights and
Hmm.
really connecting the patient journey. Because for a patient, look, lab data tells the story of your health from when you're born until when you die. Lab
That's
data
right.
starts being generated the second you enter this earth. But historically, that information hasn't been utilized in an ongoing longitudinal way where, like,
Why?
you,
What? How come?
why? It makes no sense. It's because of the way healthcare is set up from an economic perspective. Nobody gets rewarded for trying to harvest insight from your entire longitudinal lab information. They get paid every time a lab test gets run. They get paid every time that results in you having some type of illness that you have to come in and be treated for. But what I saw in starting HC1 was the fact that if you could harvest insight from this lab data set at scale and you could enrich it with other kinds of data sets, you could start getting close to this ability to predict where people are going with their health way in advance and start getting ahead of the curve. And then ultimately, for the patient, if you're going through your healthcare journey, you don't really care where conventional ends and more experimental research begins. If you find yourself on your journey where the conventional isn't working, or where there's something that's more from a research perspective promising for you, wouldn't you like to have that just be a continuous part of the entire journey? And wouldn't that also accelerate the advancement of these new therapies? So
Yeah.
that's what happened with my mom. Was she hit the wall from a conventional perspective, and there was no answer as to what's the best possible program for me from a clinical research perspective, where I might have a chance at prolonging my life and having a better quality of life, but also I might help other people because we can advance these therapies. So HC1 really is very much born out of that desire I've had for 25 years to connect the patient journey in a way that allows you to navigate in an optimal manner the actual provider side of healthcare, ideally prevent illness. But then if you end up with something that is affecting you in such a profound way, that there's a way to connect into more of the pharma world if and when that is appropriate. So that's HC1. We also have 3Aware, which is the emerging leader in real world evidence for medical device manufacturers.
Hmm.
And then we have Decision RX, which is providing optimized medications for high risk patients in value based healthcare plans. So, patients that are taking multiple medications and who are failing one or more of them, which happens very
Often.
often. And when that happens, people fall down the stairs and break their hip. They end up in the emergency room. They end up in the hospital. They end up needing these really expensive services. And also, obviously, their quality of life is not good. So we've got lab data insight, we've got real world evidence for medical device, and we've got really what amounts to medication insight. And so each one of these areas, while they're completely separate and distinct areas of healthcare, all of them have this common thread of we plug into the data, we enrich it, we organize it into this health matrix, and then ultimately we improve outcomes and we boost the bottom line. So it's a recipe really that we've built that I think we can apply across so many different areas. There, I have a roadmap for the next 100 years. So hopefully I'll be that first person to live to be 150.
Amazing. You said so many different things that, and I just have a lot of different thoughts going through my mind. On the HC1 side, you're mentioning around this lab data and how there really is nothing that kind of pieces all of it together. Who owns that data? Is it the health system? Is it the hospital? Is it the lab company, the Quests of the world, the Lab Corps of the world, or does the individual, the patient own
Or
the
is it the
data?
patient, right? Yeah, yeah,
Yeah.
yeah. It's a so importantly, the data needs to be governed by the regulatory framework of HIPAA, and we engage under a BAA with all of
Yep.
our clients.
Business
So we have
associate
a
agreement.
business
Got it.
associates agreement, and that means that we are handling insight that is being served to providers that they are using to support better care for individual specific patients. So it's all under the construct of delivery of care. But there's this other level of value that is needed that involves taking all of that data and making it so it is not personally identifiable anymore, but is constructing the view of what's happening with patients that are similar to each other and constructing really what's like a digital twin to say, when you see this constellation of signals, it is predictive of some certain thing in the future. And when you have over 10 years of longitudinal information across hundreds of millions of patients, you can start seeing insights in there that no human could ever have uncovered. And that's where AI comes in and machine learning and all these things that people talk about from a advanced data science perspective. We apply those techniques in order to identify these constellations of signals that, for example, we've proven a model that through the identification of signals in routine laboratory test results that are the kinds of tests you would have when you're getting physicals and just like
Right.
going through your life, that we can now identify signals that are predictive of people who will in the future experience cognitive decline. So people who ultimately would end up with Alzheimer's at some point can be managed more like a chronic illness to slow down that progression. So ultimately you don't end up with these catastrophically terrible Alzheimer's cases. That's just an example. And there are like infinite examples like
Yeah.
that, that with this de-identified information, you can start applying these models then to actual patient journeys to help the patient. So it's interesting because a lot of times this concern about data privacy and this idea of HIPAA can actually be used as an impediment to delivering better patient care. And in
Hmm.
reality, that's just so backward and never why HIPAA was created. But if you take the data, you de-identify it correctly, you have expert determination to ensure that that de-identification is used, being used in a way that works, you can unlock so much value, even though the data you're running analysis on is de-identified. Does that make sense?
No, it makes total sense. It just seems as though that, I'm just going to say health systems. Health systems are sitting on this asset that they don't even realize is a major asset. And what you and the team are doing is you're now able to derive insights that can take someone and passing them along to other, I'll just say other service lines where they didn't even realize that they needed to have access to that service line. Your case in point around cognitive decline. Interesting that you said that. I'm actually experiencing that now personally with my dad. Is that imagine if we knew that years ago? What would be some
Yeah,
of the things that we could get him into,
right.
enrolled into, so that we could be proactive around it as opposed to being reactive? My question to you is as you're doing that, you're still generating, again, getting back to the operating business model. You're now still able to generate revenue for a health system because you're moving people into those other service lines. How does this work on the value-based care side, which is more on the preventative side? I'm just, the two are kind of
Sure.
going in through my
Yeah,
mind
they
right
can be.
now.
They can be somewhat diametrically opposed as you're thinking there, but the so the payviders who are engaging in value-based care benefit by managing patients to keep them at home and keep them
Right.
in, not preventing them from accessing services, but providing the most efficient services that provide the best possible outcome, the healthiest possible journey for the patient.
Mhm.
So, as it relates to HC1 specifically, when you diagnose people sooner and more accurately, then you can get them on the right therapy or even prevent the need for future therapy. CKD is another good example. Chronic
Mhm.
kidney disease, incredibly expensive, catastrophically bad for the person and the lifestyle that they have and the quality of life that they have. And so that's an area that you can identify a signal in a lab information. It's very subtle. You might even be within a normal range still, but when you see this and that and the other thing trending in a certain way, ultimately, and I'm using this shorthand so that
Yeah.
we don't you'll get bogged down in a lot of scientific discussion, but the reality is you can help get ahead of that so nobody has to crash or fewer people crash with CKD and end up on dialysis and very expensive, problematic kinds of treatments. So that's how think about it as making sure every patient gets the optimal testing. And that's also eliminating unnecessary tests because if you're testing somebody more than is needed, you're burning cycles and time and cost that is not going to get paid for
Right.
anyway.
Right.
And especially under value-based care, but even under fee-for-service care. But then on the other side, there are a lot of patients who are not getting tested as they should be based on their health profile. Somebody who's pre-diabetic who needs to have their A1C retested, that is not something that always happens the way that it should. That's just a simple example. But there are a litany of examples where through effective lab stewardship, which is about ensuring all patients get the optimal testing, you end up diagnosing patients and monitoring their health better so you could be more proactive. But in terms of value-based care, every single business that we have has an element that helps enable value-based care because we believe that's the best possible way to align incentives between providers and patients. And so Decision RX is actually a purely value-based care data insight company that is able to impute based on all of the prescription claims exactly which patients are highest risk and most likely to have these really expensive outcomes, and then uses this combination of AI and human engagement on the side of the pharmacist who are able to provide a concierge level of precision prescribing to every single high risk patient. Like, how cool is that? And so,
Yeah.
the only way to do that is to use technology as that first line, though, that figures out who those people are who can benefit. And then those pharmacists who went to school not to count pills, but they went through all of that to help
Right.
patients are able to have this really cool work that they do. So, across the board, Michael, we're finding ways to create this value based care paradigm and make it effective. Because frankly, a lot of people are in value based care and don't even know what to do to make it effective. It's just
Yeah.
like, hey, you know what I'm saying? It's pretty wild.
Yes. So let's talk about impact. What have been some of the ways that you've seen your work with you and the team improve lives and improve the system?
Sure. Well, from a lab insight perspective at HC1, we're driving tens of millions of interventions a year that are ensuring patients are being tested more effectively, and then also helping to ensure that those patients are getting on medication therapies that are going to work for them through what we do at Decision RX. So if you think about the patient journey, our three companies actually are touching a massive swath of patient
Hmm.
journey, and they
Right.
all relate, to similar patients, but they're just separate businesses. From a 3Aware perspective, which is our medical device real world evidence company, we're providing insight that is mined using natural language understanding and AI from the physician's notes within the electronic health record. And one of our strategic partners with that business is Mayo Clinic. So we're mining insights from all of Mayo Clinic's electronic health records. And it allows us to give you real time information on any type of medical device that is resulting in an adverse outcome more often than it really should be. And ideally, you've got no adverse outcomes, but that's just not
Right.
life. You have some. But you remember back in the day when there were metal on metal hip implants that
Yeah.
happened? There's
Yeah.
some, yeah. And then there were also like leaking breast implants. And this resulted in a massive amount of really horrific revisions for patients. Um, that information at the time could only be gleaned down the road once you had enough people raise their voice and say, this is not okay. And then just sort of anecdotally figure out that they're not the only one. With
Hmm.
3Aware, we're mining those insights instantaneously to ensure that if there is anything that needs some type of action taken, it can be taken to benefit patients before multiple patients are harmed. But then, actually, also, I think even more importantly, because most medical device companies are pretty on top of quality. They do studies and they
That's right.
ensure that they're not going to hurt patients. So it's more the exception than the rule. But even bigger is that the acceleration of innovation to make devices better is being enabled by 3Aware. For example, it's identifying in the physician's notes where there will be an application of a device that benefits the patient that wasn't the original intent of the device. So label expansion is what that's called. So it accelerates this ability to apply devices to multiple different conditions
Yeah.
and also informs innovation for new devices. So
Hmm.
we've got examples like that across all of our companies. And that's what's really exciting and makes it fun to get out of bed every morning.
Yeah, I mean, you just have all these different across the different entities that you have. I mean, there is a common denominator amongst them. And I'm just sort of curious because, leadership styles, they vary. And how would you describe yours? And then, I guess what influences have shaped your leadership?
Sure. Well, I'm big on culture and ensuring that you have values that the people that are on your team share. It just makes it so that you can work as a team and trust each other, and you can achieve really great things knowing that you can depend on the other people on your team. And the four specific values that I apply when I think about any company or any person that I'm looking to do business with, it's really curious is the first one. We talked about that earlier.
Mhm.
Accountable is the second one. You have to have people who are going to follow up and follow through the way they're supposed to. Collaborative, because healthcare is not an individual type of environment.
That's
If
right.
you can't work well to get to a goal with other people, it's going to be tough. And
It's a
then
team
ethical.
sport.
Yeah, it's a team sport. So those are the four things: curious, accountable, collaborative, and ethical. And when you have people who align with those traits, you end up with a really high functioning, high performance team that can accomplish anything that you set your mind to.
Hmm. And what about I'm just thinking about my life and mentors that have really poured into me. I think it plays a pivotal role in terms of shaping you. Who's been a mentor to you, and how have you been able to sort of pay that forward?
Yeah, I've been so lucky to have a lot of people mentor me who really understand business and also understand the needs that exist in healthcare. But the person that certainly stands out the most for me is my dad, who was the oldest of all. He's 82 years old now, and thankfully he's in great shape still. But he was the oldest of 11 kids, and they
11.
were very, yeah, very poor. His parents, I never knew them. They passed away before I was around. But they were two sets of twins, and just tons of kids. And he kind of had to help out a lot because his parents passed away young, and but he ended up going from playing college basketball, where he was successful in that sport, to being a banker. And so as I was growing up, I was observing him go to work every day in a suit and talk about these different businesses he would give loans to. And because that was the main thing banks did back
Yeah.
then, and over time I started to pay a lot of attention when he'd start talking about entrepreneurs. And he always held these entrepreneurial customers that he had, and who a lot of them became friends of his, in high regard. And thankfully, as he advanced in his career, we were able to move with his promotions and ended up in a nicer neighborhood, and lived around a number of people where I was friends with these folks, and their fathers or mothers were business people and executives and entrepreneurs. And so just seeing him and learning from him was huge. And frankly, part of it was because he was a banker underwriting loans, he always could point out all the soft spots in an idea, all the ways that it was going to fail. And so I
Yeah.
lived to try to convince him of an idea that I had, that it was a good one. And
Yeah. Who
over
needs
time, I
Shark
think that
Tank when
really
you got
helped.
one of the judges in your house?
Exactly. I had Shark Tank in my house every day. He would tell me all the ways it wasn't going to work. Exactly. That's why I don't need to watch Shark Tank. I already lived it.
Oh my God. You said something earlier about having the business mapped out over the course of the next 100 years. That's amazing. I'm just sort of curious around sort of this personalized medicine and how you've been able to sort of take all these longitudinal insights from these labs. I guess, how do you envision, just maybe even just as a CEO, how far do you look ahead? Are you talking 10 years? What does 10 years look like ahead? And how is sort of HC1 positions itself
Yeah.
to be at the forefront?
Yeah. Well, so at AI, there's this thing called RLHF, which stands for reinforcement learning through human feedback. And I think in the next 10 years, you will have RLHF integrated into every type of care delivery. So this is not about AI like HAL 9000 from
Yeah.
2001: A Space Odyssey, where it takes over and runs on its own. It's about having this beautiful marriage between human insight and knowledge and brain power, and technology that is continuously getting smarter to power that person up. I think about it as like bionics. So back in the day when I was a kid, there was this show called The $6 Million Man, and this dude had been all remade into this bionic kind of superhuman. And I think when applied effectively, AI can create that type of environment for caregivers where they're able to do so much more and be operating at the level where they don't have to do all of the mundane things that suck up their time.
Yeah,
They can operate at that level of making those important decisions, of connecting with the patient. There's so much more to health than just a number. It's not just about you have this lab test or that. There's a lot that has to do with whatever version of it you're interested in. People having a positive mindset, people having some connection to some higher order purpose, people having
that's right.
community. Like there's
That's
so
right.
much that goes into making healthcare work that I don't think we have enough caregivers that have enough hours in the day to do all of that. And so I think in 10 years, you'll look around and say, can you believe you used to have to go in and fill out the same form 5 times? And the people had to waste their time at the hospital making you, waiting for you to fill out that form. And all those little things that result in the experience you have today. Like I use One Medical and I've had concierge primary care for a lot of years. And I switched recently to One Medical. I thought, well, let's just give it a try. And it is absolutely fantastic. Now, is the testing as comprehensive as my concierge doctor? Absolutely not. But if you know what you need, you can ask for all of it and you can have all those same things done. But you can literally go into an app and book an appointment within in your neighborhood within the next 2 days. And you can chat online if you have some kind of an urgent issue. It's just that's a simple example of how technology is augmenting the
That's
access
right.
part of healthcare, which I know is near and dear to your heart
Yes,
and mine as well. But there's just something so much bigger there where we're going to look back and say, I cannot believe that healthcare used to work in XYZ ways. And that's what AI is going to do for us in the next 10 years.
fascinating. So there's only one fitting way to wrap up this conversation because it's been super fun. We're going to do some rapid fire questions. Um, and you're going to just kind of share what you got there. So Nick's English Hut, sink the biz or a slice of Stromboli?
Gosh, these days probably Stromboli, but I
How
sank the biz a lot back in the
about,
day.
how about this one? Dun Meadow on a sunny day or a snow-covered Sample Gates? What's more iconic?
Oh, I think Dunmeadow on a sunny day because I remember that when I went and visited as
Okay.
as a prospective student of the
Okay.
university.
And sort of what's your go-to strategy for unwinding after like a really busy day?
I I play guitar, and that's a really nice way to unwind. Yeah, I'd
Okay.
say that's probably the main one. During the summer, when I'm in the city of Chicago, which I have a condo in Chicago where I stay occasionally. I'll go for a walk along Lake Michigan, which is really awesome. And oftentimes I'll do
Spectacular.
it while I'm on a phone call or, but that's something I do. I'd love to ask you that question because you have a crazy schedule just like I do, and you're in healthcare, which is hard. Like, what do you do at the end of the day?
Listen, if you want to really have unwinding, I like to pull weeds when it's nice outside. Pull weeds, it's completely mundane, but it somehow is so therapeutic. And then the other way for me is, like you said, take a nice walk. Got a number of different, forest preserves near me. And anytime being out in nature, there's a level of connectedness that you feel. No, no electronics. Just go for a
Yeah,
walk, listen to the birds, listen to the sounds. It's my earth pod. That's what I listen to, my earth
that
pods.
makes sense. I like
Yeah.
that. I'll
Yeah.
do more of that too.
And
Awesome.
and then just sort of best piece of advice that you've ever received.
Best piece of business advice I've ever received is to do something where you make money while you sleep, which is code for build businesses that have recurring revenue. I'd say best piece of personal advice has been to invest your time with those authentic people in the world where you uh, like what you envision when you say you become the average of the three people you spend the most time with.
That's right. That's right. Hey, just before we let you go, where can people follow you, your journey, HC1, all these other entities? What's
Yeah.
the best place for them to learn more about your work?
Yeah. So my LinkedIn is Bradley Bostic, Bradley Bostic. And I also have a podcast called Boom Bostic Health. which I would love to have you on sometime, Michael, where I have conversations with bold leaders. So very complimentary. Our focus is very much on the business of healthcare and those folks who have aligned some kind of a game changing capability with an economic model where it actually is sustainable. Because as we talked about, money drives the future. And if it's not there, you can't make it happen. But those would be a couple of great ways to connect with me. I'd love to hear from anybody who would have any feedback or ideas on ways we can be doing better.
Well, awesome. Listen, you get the open invite to come back and share more cool stories. It seems as though probably in the next few years, presumably there'll be more companies that will be birthed from you. I think we were created by creator to be creative, and you definitely have the creative juices going here. So it's really great to have you come on. Thanks for your time today, for your wisdom. It's been a real pleasure.
Oh, thank you so much. It is humbling to be on a show like yours. I know you've built a great following, and I really appreciate you having me on. Have a great holiday, Michael.
You
Thank
too.
you.